In this video, let's discuss one of the organic corrosive acid, that is oxalic acid. This is also known as acid of sugar, and they have a appearance like white, transparent, prismatic crystal appearance. And mode of action, normally they will causes the corrosion. Normally, they will causes the corrosion of the mucous membrane, but rarely it will also affect the skin. And it will produce also three conditions, that is, it will cause a shock, hypocalcemia, and also renal damage. In It will produces the shock when the poison is taken in very large doses, so it will causes a shock and then it leads to an rapid death. And hypocalcemia, this oxalic acid will get combined with an serum calcium, and then it will causes an hypocalcemia. So this hypocalcemia causes an muscular convulsion, and then also it will affect this blood coagulation. And this oxalates which are produced, means which are present in this poisoning, will causes the tubular necrosis, and then in 2 to 14 days it will causes a death because of this uremia. And fatal dose is about 15 to 20 grams, and fatal period is about 1 to 2 hours. And signs and symptoms will be different depending upon the type of poisoning. Means there will be a three types of poisoning, that is a fulminant poisoning, acute poisoning, and delayed poisoning. In case of fulminant poisoning, there will be a burning pain in the stomach, and also vomiting will be present. This vomiters will be having a character like a coffee ground vomiters will be there, and also particularly there will be a bloody matter with this vomiters. And also the pulse is very imperceptible, and there will be excessive languor, means excessive tiredness or the weakness will be there, and the person will usually die within a few minutes in case of fulminant poisoning. And this disease will begin so abruptly and terminate so rapidly. And in case of acute poisoning, this acute poisoning normally occurs by taking this by taking this poison in a very large dose, when the patient may survive for about a few hours, and it may be characterized by the hypocalcemia, and some digestive upset will be there. And in case of delayed poisoning, there will be a uremia, dysuria, and hematuria, etc. And treatment is, first we will wash the stomach using this calcium lactate or gluconate. And there is a antidote for this oxalate poisoning, that is, any preparation of this calcium we can use as this antidote. This calcium preparations convert this poison into an insoluble calcium oxalate. Example, lime water, calcium lactate, and calcium gluconate. And we will give this calcium gluconate 10% in like a 10 ml we will give intravenously, at frequent intervals we will do. And also we will do the dialysis or exchange transfusion in case of this renal failure. And in case of severe cases, we will take a parathyroid extract about 100 units intramuscularly, and we will give demulcent drinks, and the bowels may be evacuated by castor oil. And uh, let's see the post-mortem findings. And in mouth, there we already know that in action, we study that it will produces the corrosion of the mucous membrane. So of course there will be a corrosion in the mouth, throat, esophagus, and the stomach. And also esophageal mucous membrane becomes so congested with a longitudinal corrosions will be there. And in case of stomach, it will contain a dark brown granulous liquid because of formation of this acid hematite. And the blood vessels under the and the blood vessels which are present under this mucous membrane appears dark brown or black streaks in the form of networks because of this calcium oxalate crystals will get deposited. So there will be a appearance like black streaks in the form of network. And in case of kidney, there will be a congested, swollen, intense cloudy swelling, and also hyaline degeneration of the cellular tissues with tubular necrosis, but the glomeruli is not affected. So I hope this is useful. And let's see again in a brief that we studied oxalic acid is one of this organic corrosive poison acid, and it is also known as acid of sugar. And we saw this identification how it is appear, that is white transparent crystals, and mode of action, like it will produce a corrosion of this mucous membrane, but rarely it may affect this skin. And according to systemic action, it will show shock, hypocalcemia, and then the renal damage. And a fatal dose we know 15 to 20 grams, and period is 1 to 2 hours. And signs and symptoms will be changed depending upon poisoning, that is permanent poisoning, acute poisoning, and delayed poisoning. Treatment, mainly we will the antidote is there, that is any preparation of calcium we will use, that is so that it will, this antidote will convert it into an insoluble calcium and calcium gluconate parathyroid extract. And in case of post-mortem findings, there will be having an corrosion in this mouth, throat, and esophagus, and particularly in esophagus there will be an congested mucous membrane with longitudinal corrosion. And in a stomach there will be an brown glomerulus liquid because of formation of this has acid hematine will be there. And there will be a streak, black streaks will be formed in the form of network because this calcium oxalate will get accumulated there. And in case of kidney, kidney is very congested, like swollen, intense cloudy swelling will be there, and also it will causes a tubular necrosis, but this glomeruli are not affected. I hope you understood, and thank you.